Getting on a bus or train during winter sends a shiver down your spine. You are not alone. Australians fear public transport more than anything else when it comes to spreading germs. And with so many of us succumbing to colds at the moment, are they right? Dr. Cindy Pan joins us now right here in the studio. Cindy, good morning to you.
Good morning.
I would have thought of a lot of places of catching a cold, a lot of ways to catch a cold, but riding a bus or a train wouldn't have been top of mind.
I guess you're right there. I think planes are probably worse in that respect. But I think any time we've got a large number of people congregating together in a confined space, there is always some risk, especially in cold and flu season when there is a lot of infection around. As soon as you get a few people coughing and sneezing and spreading basically aerosol droplets of infectious material, yeah, there is a risk for infection.
We've had, in recent winters, we've had the swine flu, bird flu, all kinds of things like that. We seem to be evolving into something completely different this year. Everyone seems to have a lurgy of some kind. What are we getting?
Yeah, look, I think it's probably related to the weather conditions. I think we had all those really rapid changes early on, and then I think May was apparently one of the coldest Mays we've ever had. And I think there's always been contention about whether so-called catching cold leads to an increased risk of infection. I think that various studies have shown conflicting results, but in the end I think what it is that being exposed to extreme cold can lower your immunity temporarily, and then if there is a large number of cold and flu viruses around, then you are probably more inclined to catch them. And then of course the more people who are around with coughs and colds coughing on each other and spreading infection, then yeah, it's sort of the ball is rolling
Is
on.
it mainly being in the line of someone's germs like that, or is touch a significant way of catching a cold?
I think, yeah, it's both. I mean, obviously, when you cough or sneeze and you actually have that aerosol spray and people inhale it, and I think, you know those football matches where they had those big trumpets where they were blowing the trumpets, they actually found...
Vuvuzela or something, what did they call those?
There was actually a study that showed that was actually spreading infection, which is kind of a very novel way of spreading infection. Yeah, but obviously, yeah, contaminated surfaces. So, for example, if you cough into your hand or you blow your nose and you've got infectious particles on your hands, and then you touch the surfaces, they can become contaminated. Or even, so, I suppose, sharing a pen or a phone or a keyboard, things like that. It is possible that you know, the virus can live for a certain amount of time. And
how long does the virus live?
I think it varies what people describe, but it is up to a matter of hours. And so I think that even though you might seem a bit obsessive compulsive, it is worthwhile to regularly clean, frequently touch surfaces, as well as, I think people have talked about coughing into your hand, but these days they talk about coughing into your elbow, because if you cough into your hand and you have all those infectious particles there and then you touch things, it's going to spread infections, whereas you're not likely to touch things with your elbow. So coughing and sneezing into your elbow, if you can think of that, that will probably decrease the risk of infection to some degree.
Well, that depends if you're a hugger, Cindy.
That's true, that's true.
Now, when it comes to getting rid of these germs, there's lots of little bottles around you can get with disinfectants, wipes, sprays, all sorts of things.
Yeah, well, I guess, you know, people aren't always able to rush off to the bathroom and wash their hands, so there are those hand rubs, the alcohol-based antiseptics and things like that are good. And some of them, I think, you know, they can be a bit drying on your skin, so I think you also have to moisturise, and some of them are a little bit more moisturising as well. But then regularly cleaning, you know, frequently touched or potentially contaminated surfaces, that is worthwhile. But I think the most important thing is, you know, I guess avoiding too much close contact with people who are particularly unwell, and when you are yourself unwell, perhaps, you know, try and avoid going to work and places where there are a lot of people congregating.
Oh, don't give them any more encouragement not to come to work. Dr. Cindy Pan on the ways of avoiding and catching coughs and colds and flus. Thank you very much for coming in.
Thank you so much.
Appreciate it.